You are my river, my only river. You make me happy when skies are gray.
Viva Asmalesh comforts baby River.
Oh, yes. Oh, I know. Tell me more.
The way her mom once comforted her.
Here's my mom and River.
Viva's mother passed away after a 10-year battle with a spinal cord condition.
I was with her almost every single day.
What Viva witnessed in the hospital still takes a toll.
I cannot begin to enumerate the number of times we have been on the receiving end of microaggressions.
Treatment she feels was because of the color of her skin.
If I were a 60-year-old white man, I can almost guarantee that she would not have told me that I was being aggressive in my advocacy of my mom.
A new study from the Kaiser Family Foundation shows nearly a quarter of Black adults say they endured negative health care treatment because of their race.
Almost every single time that a doctor told me there's nothing more that can be done, there was in fact more that could be done.
I should have been treated very differently.
Monica Washington has 3 children. Starting in 2020, she also had 3 miscarriages in a row.
Should I be having much more than the standard testing and the standard procedures? And this woman said no.
At the time, she wondered whether her pregnancies should have been considered high risk, and she begged her doctors for additional ultrasounds.
She was trying to convince me that I just don't need one.
Her 3rd miscarriage left her in the emergency room with an infection.
I'm saying, shouldn't I be on antibiotics? Shouldn't you give me that? And she's like, your fever's not high enough. And she said, I don't meet the criteria.
Providers take an oath to do no harm. We need to hold them accountable.
Rhonda Smith with the California Black Health Network says bias and misinformation still exist in the healthcare system.
If we go back to what is taught in medical school, I mean, things that have, existed, hundreds of years ago about the misconceptions of Black patients even tolerating more pain than white patients do, and that's totally not true.
According to Kaiser Family Foundation study, nearly a quarter of Black adults who were pregnant or gave birth said they were denied pain medication they thought they needed.
What are some specific ways that people should go about being a better advocate for themselves?
I think patients should kind of do their homework and do their research and become a lot more knowledgeable about the situation. If we don't feel good about a situation, trust your gut and ask for what you want, because it's your life and your child's life who's at stake.
Before giving birth, Viva took matters into her own hands, having an honest conversation with her OBGYN.
Listen, as a Black woman, I often do not feel heard by doctors when I'm talking to them, right? And she asked me to share more. She was really patient and listened, really listened.
That led to a healthcare experience full of trust for her and little River.
You'll never know, dear, how much I love you. Please don't take my river away.
We chose not to name the healthcare systems Viva and Monica were part of because, as you heard, this is not specific to one hospital or one doctor. In fact, they experienced these issues at several different locations. The main message from Rhonda with the Black Health Network that she wants patients to remember: if you're not comfortable, you can fire your provider and you should seek other options.